Next speaker will be from the Inter-Parliamentary Network for Global Health. Please, you have the floor.
Good afternoon, honorable speakers, members of parliament, and ladies and gentlemen. I am Amar Patnaik, a former member of parliament from India and Unite Global Board member since 2019. It's an honor for the Unite to be accepted as a permanent observer of the IPU. Unite is the only global network of current and former members of parliament focusing specifically on global health issues. Our work has supported parliamentary engagements and legislations on infectious disease prevention and healthcare equity in multiple geographies. We collaborate with partners like the World Health Organization to empower legislators with evidence-based tools and technologies. As a non-profit, non-partisan network, Unite represents approximately 500 members from over 110 countries. I thank the President of IPU for the opportunity to address this assembly. Social development is about placing the well-being of people at the center of sustainable development. Health is an essential condition for well-being, and therefore it needs to be a central part of our discussion here as well. Health is a human right. It is up to us as policymakers, decision makers, and representatives of people to ensure equitable access to health for every single individual. There can be no sustainable development without universal health coverage. During COVID-19, we all saw not only the importance of international collaboration, but how intertwined our health systems are. From the Atlantic to the Pacific, from New Zealand to Argentina, from South Africa to Finland, every single one of our citizens and governments faced unspeakable trials. It was cooperation that got us through those dark days. Nevertheless, our countries are still to agree on the pandemic agreement, which would set the guideline for collaboration in the case of a future pandemic. Even worse, today we see the international health system being threatened, funding for foreign aid and development being cut, financial support for HIV treatment being reduced, the entire concept of vaccination being undermined, and even the invaluable work by the WHO being questioned. It is our responsibility as parliamentarians to hold our governments to account, to make sure that they do right for our citizens. We must all stand tall in defense of global health. Together, we must also call on each and every one of our governments to invest more in our national healthcare systems. We must implore them to transform health systems from reactive models into preventive, well-being focused approaches. Strengthen primary healthcare services, make health services affordable, and ensure that vulnerable populations are not excluded or stigmatized. We must leverage digital health tools to promote higher efficiency and accessibility to health. Parliamentarians, as political leaders in health, are in a strong position to emphasize the impact of financial investment in health. I call upon my colleagues to show support for the international organizations such as the WHO and the Global Fund that implement crucial health programs and emergency response strategies to save millions of lives. The 8th replenishment of the Global Fund to raise US $18 billion needs to be supported, that it would save another 23 million lives and avert approximately 400 million new infections by 2029. I commend the IPU and all its structures for the recent decision to expand the advisory group on health into a full committee on health. Unite looks forward to working with the committee. Health is the underpin of all social development. Strong health systems drive productivity, stability, and economic growth. We cannot hope to ensure social development and sustainable development without ensuring health at all levels and for all. Thank you so much.
Thank you, Mr. Speaker.